Hey guys, Dr. Schumacher here with Campbell Chiropractic Clinic. Today our video is all about feet. So we have my wife Mackenzie back in with us today. Mackenzie is a former collegiate basketball player, very good basketball player. While she was in college, she had a lot of feet issues. She has very high arches, puts a lot of stress, especially right on that middle part of her foot. So today what we're going to do is some instrument assisted soft tissue work. We're going to get in there with some muscle scraping, help those tendons, those fascia, those ligaments kind of relax a little bit. And then we're going to do some adjusting on her feet as well as her ankles. So first off, we're going to get started with some of that Graston work, some of the muscle scraping. So we're going to do some soft tissue work right in the middle part of this foot, right on this plantar fascia. Also with this tool we can get kind of in between those metatarsal joints, some of those smaller joints right in that foot area, kind of free up that tension and keep this soft tissue happy, so my wife is happy. And she also has been experiencing a lot of muscle cramps since she's stopped playing too. On her feet a lot during the day as a school teacher walking around. We've been working with her on her footwear, trying to get some proper footwear for her, but just still a lot of tension right in here. And so what we're doing is just kind of freeing up some of that tension on this fascia, keeping it nice and relaxed. Also, again, it facilitates some of those mechanoreceptors, proprioceptors, and just helps her feet know where they are and just keep moving better. Allow some of that blood flow for some healing. Overall, just provides her some of that relief. How does that feel while I'm applying that?
Good, I think you should keep going.
Got a little bit more here. Not painful, is it?
The outside is a little tender.
A little tenderness.
Yeah.
It's where she holds a lot of that stress right with her high arches in the medial aspect here, but on this lateral portion, a lot of that's where her foot meets the ground, so a lot of that weight and stress gets put on this outer portion of her foot. So now we got Mackenzie face up here. What we're going to do is, go ahead, put this leg down for me, is we're going to work in a little bit of this ankle region. So if you can kind of see, she has a little bit of loss of that dorsiflexion, meaning that she can't really extend her toes back up to her knee. And what happens a lot of times with this is that you lose that hip extension too. So a lot of that stress that is getting applied here, also she's feeling in her low back because her hip can't extend all the way back. So anytime we're dealing with the feet or the lower extremities at any point, we always like to work up that kinematic chain to the knees, to the hips, and then eventually the low back. So today what we're going to do is we're going to focus on these ankles. So we're going to get some of these joints moving for you. That was a good release there. Same thing on this foot too. This one has a little bit more, still kind of restricted though. So after adjustment, we always like to reassess, kind of see what you're like after the adjustment, make sure we didn't miss anything, and make sure that there is improvement. So bend these up, just relax your ankles for me. Do feel a little bit more of that extension back up towards your knees there, that dorsiflexion. Feel a little less restricted for you?
Yeah, definitely.
Good. Just a little bit more. So what we'll do is we'll kind of work back up. We'll get Mackenzie back in here. We'll kind of work on that knee. We'll take a look at that hip, but she also has been dealing with a lot of back issues, especially after pregnancy too. So we always like to check that area out on a regular basis. But today a lot of her problems were down in these feet and ankles. So appreciate you coming back in today. Thank you guys for watching the videos. Make sure you hit that subscribe button. Go check out my Facebook and Instagram, and we'll see you guys soon. Thanks.